The claim I'm responding to is anesthesia-free dental cleaning is safer for your pets. My opponent's secondary claims are anesthesia is risky and unnecessary, and comparisons between the processes of vets and hygienists. Today I'm going to prove that the reasoning process and evidence the advocate uses to support her claim has several flaws. The advocate's claim that anesthesia is risky and unnecessary is a hasty generalization and based on evidence that is very old. First, the percent of cats and dogs that experience any of the complications associated with anesthesia ranges from 0.43% to 12%. The fact that majority of cats and dogs do not experience any of the complications she mentions undermines her claim that anesthesia is risky. Also, the advocate uses the near-death experiences of her pet and her friends' pets to support her claim that anesthesia is not safe. Pet Partners, a nonprofit organization for animal welfare, say that studies reveal anesthetic death rates average 0.1% to 0.3%. Her conclusion relies on the number of anesthetic deaths that is less than 1%. In addition, the evidence that the advocate uses is over 10 years old. The advocate is using statistical data that is outdated and does not reflect the advancements made in the anesthetic process and anesthetic technology. We'll note that veterinarian and certified specialist with the American Board of Veterinary Practitioners stated in 2011 that most significant changes in the last 10 years is doctors providing preoperative blood tests so that they can determine the pet's health status prior to general anesthesia. Novak goes on to say the second biggest change is monitoring of the patient with such instruments as the pulse oximeter, which checks the patient's heart rate and blood oxygen levels. The comparisons between vets and hygienists made by the advocate are irrelevant arguments, are based on generalizations with exceptions, and do not consider the other alternative. For one, the advocate states the name of each step in the teeth cleaning process for vets and hygienists, but she does not explain why the different steps are safer over the other. She merely says that vets do x-rays and anesthesia, whereas hygienists do not. This point does not advance her claim and is therefore an irrelevant argument. In fact, had there been an explanation of what the purpose is for x-rays, it would contradict her claim. Veterinarian Dr. Kevin Wilson explained in April 2011 that x-rays are a way to see the tooth root and supportive structures to determine if there are problems. Many times, the tooth may look healthy on the surface, but can be fractured or infected below the gum line. This step is very important due to the fact that more than 28% of dogs and 42% of cats have hidden dental disease, according to Dr. Elizabeth Bratt, a graduate of Tufts University Cummings School of Veterinary Medicine and owner of All Creatures Veterinary Hospital in May 2011. Secondly, there are exceptions to the advocate's claim that hygienists are actually trained to clean mouths as opposed to vet technicians. In December 2010, Maja Bajanka, a hygienist who practiced veterinary supervision, said that veterinarians are reluctant to hire a dental hygienist due to their lack of formal education on the medical care of animals. She goes on to suggest that dental hygienists should consider becoming a registered veterinary technician. Also, in December 2010, Dr. Ronald Kelp mentions 2 incidents where dogs have had to have 12 teeth removed. He states the problem is that dental conditions are not being detected or managed properly by hygienists who aren't properly trained or practice veterinary medicine. Finally, the advocate only compares these 2 processes, even though there is a third option that would be most advantageous to the pet owner. By participating in home dental care in combination with these processes, a pet owner could greatly reduce the risks and costs involved with anesthesia or anesthesia-free teeth cleaning. In the end, there is no tooth cleaning procedure that is 100% safe. Whether you go with anesthesia or not, there will always be risks. If you're a pet owner and you're trying to keep your pet as safe as possible, Your best option is to regularly participate in home dental care and have your pet checked by some sort of professional. Regardless of which kind, make sure they are experienced, have insurance, and that you and your pet trust them.
All right, well, you labeled the main and secondary points very clearly. Your challenge to the reasoning process that the advocate is using is labeled and explained early on, and it comes up in a couple of places. You've got good statistic on that particular point to minimize the risk that's being talked about. The challenge that you present to the advocate's evidence I thought was reasonably well explained, although you do need to make more reference to when the source citations that the advocate had were and what they were. You do updated counterclaims, and I thought you did those very effectively, citing the information on those points. And your counterclaim arguments on those points were really excellent. They were clear statements of what your position was, and then you provided good evidence, typically a couple of pieces of evidence to support each of those points. Your analysis on the one point that suggests that it doesn't really advance the advocate's claim, so it's not relevant. Okay, I understand the point that you're making. I did like, though, that you didn't just leave it at that. You followed up with the argument that says, in fact, that if we consider the focus and the reason that we were doing the x-rays, it actually contradicts the advocate's position. I thought that that was a nice explanation, and again, some more good information that supports the position that you're taking. I think maybe sometimes the signposting could be a little bit clearer, and you could do a little bit less reading, but when it comes to content, everything was really solid in your argument. All right, thank you.